on to Fabre disease. So this is a case of a 34-year-old female. She reported GI dysfunction, fatigue, peripheral neuropathy, severe anxiety, depression, and progressive memory loss. There were no identifiable renal or cardiac conditions. And so here's just a picture of some of the systems that get impacted by Fabry disease, which is a lysosomal storage disorder with multi-organ system involvement. Her genetic testing identified a change in GLA, which is the codes for an enzyme that's important for breaking down waste products in the lysosomes. And this is the variant here that was reported in her. And if you look in the description of this variant, it's a little bit tricky, and there's a question of what this variant actually means. And they actually raised the question of whether or not this variant would be impacting clinical function based on how it affects the enzyme level and whether or not this could be a pseudodeficiency. So one of the tricks we have up our sleeve is to look at some functional studies, or in this case, metabolic studies, and look at how something like an enzyme is working in the body. So for this patient, we tested her enzyme level and found that in fact her enzyme level was low. But then we take it the next step to look at what would be building up as waste products in the cell or the substrate to see if there's a buildup, as you would expect with a storage disorder. And in this case, there is not. And so the number we look at is the lyso-GL3, and her number there is normal. So just as a picture of showing what's happening here, the blue cell there on the left is your typical unaffected individual. You're in the lysosome there, and there's this GL3 product that is broken down by an enzyme and then utilized within the cell. In somebody who has Fabry, you see that there's that big red X and the enzyme is not working as well as it should be, so you see buildup of lyso-GL3 levels. This then raises the question of what is this variant doing, if anything, right? So looking at it in more detail, it is a common variant in the general population. In vitro studies in publications early in the 2000s show that enzyme levels can be low on the enzyme assays, but it seems to be due to the substrate that's used to actually do the test, but not really resulting in true low enzyme levels in the body. But then if you look in the literature more recently, you see publications about cohorts of patients that seem to have some more neurologic-based features. And there's this question raised about whether or not there are, in fact, features of people who have this variant. But there are some challenges there as well, in that these are patients that were ascertained through cohorts of individuals who presented with neurologic features, particularly peripheral neuropathy and chronic pain. So it's tricky, right? It's hard to understand how do you interpret this and what's the next step. One opportunity is to test a tissue of the organ system that you're most concerned about. So doing something like a biopsy of the kidney and looking for storage within the kidney tissue can really help you understand in a variant whether or not there's disease that needs clinical management. There are medications, both oral and IV enzyme therapy, available for Fabry disease. So it's important to make sure that you have the right treatment or are not treating a patient that doesn't need treatment.